Yes, welcome back. It's time now for our head-to-head, where we tackle some of the biggest issues in the country being discussed across the dinner table, as well as all of the headlines, of course. Now, today we're asking, does the NHS need diversity chiefs? The NHS are currently advertising for a number of diversity and inclusion jobs on their website, with one job for Assistant Director of Equality, Diversity and Inclusion, with a salary of up to £75,000 a year. Bear in mind, the average salary of a nurse is about £30,000, which is, let's be honest, a lot less, isn't it? Yeah. Do we really need that?
Yes, well, today we are joined by Russell Thomas, Director and Senior Consultant for the Diversity Trust, and Dr. Rakib Ehsan, who specialises in matters of social cohesion, race relations and public security. Thank you both so much for joining us. So the big question we're putting to you today is, does the NHS need diversity chiefs? So you both have 60 seconds to make your case, and then we'll group together again and discuss it after that. So Rakib, I'm going to start with you. Does the NHS need diversity chiefs?
I think that what we need in the country is a deeper understanding of what drives health disparities. I think my issue with diversity inclusion managers in the NHS, they're problems surrounding local representation. I think that all too often we see diversity inclusion managers, they're not necessarily integrated in the local communities that they're meant to serve. They don't possess the specialist knowledge to serve those communities well in terms of understanding the realities on the ground when it comes to barriers to accessing healthcare services and specific health problems in particular communities. So my issue is that we do need to understand what drives health disparities in modern day Britain, but at the moment, diversity and inclusion managers in the National Health Service, all too often they're not well equipped to fulfil their duties.
Or right. just within. You had 4 seconds-ish. Yes, absolutely. Well, we'll throw over now to Russell Thomas, of course, Director and Senior Consultant of Diversity Trust in Bristol. Your 60 seconds starts now. Do we need diversity chiefs in the NHS?
Most definitely. So, having a senior leader in an organisation or a senior sponsor around equality and diversity is really fundamental, very, very important in order to get things moving, in order to set the tone, create the right environment, create role models for other individuals to be inspired, to be able to move forward and be successful in those areas. So really investing in those senior individuals, those senior leaders, is really important, and also it's a great example of commitment in these issues. If we're going to talk about finance, we talk about finance in terms of some of the most successful companies in terms of financially, also communities, are those that are the most diverse and the most innovative organizations. There's been a lot of different grievances and issues that have come out, that will be coming out all across all different areas across the NHS, and that's going to cost us, the taxpayer, lots and lots of money.
That's your time, I'm afraid. That's your time. Your time. I'm going to stick with you, actually, to start with, Russell, if that's OK. The NHS is already one of the most diverse employers that this country has. How on earth can you justify paying someone to oversee that more than you pay people who are actually saving lives?
For me, it's about, again, as I was saying, the importance of such a role in order to create that team, to say, in a sense, creating money, creating opportunities for people. And, if they're saying we're treating each other better, treating staff better, but also they're treating patients better as well, better quality of service, better experience for those individuals. And we see so much, people with mental health problems, mental health concerns, and loads of those types of issues. And a lot of this is about the way in which we treat each other. And if we can treat each other a lot better, and care and compassion towards each other, then I think things will be a lot better. So I think justifying that, for me, it's a number, but justifying that if somebody's in there, as it's completely what your other guest has said, and is doing the job correctly and has the knowledge and experience, I think can work wonders.
Rakib, you respond to that. So this 75 grand price tag could be justified because actually, if that person's doing their job properly, then everybody else will be doing their job better.
Well, I think the main problem there, Mercy, is that, as I said before, all too often the people who are positioned in those roles simply do not have the local specialist knowledge to fulfill their duties. So I'll give you one example. I know cases where we've had diversity and inclusion healthcare professionals in Luton which have been drafted in from rural Northamptonshire. That's not out of community, that's not out of town, that's not out of county, that's out of region. So I think that what we see with, in terms of positioning people into these diversity and inclusion roles in the National Health Service, all too often it is a white collar tick box exercise. And I think that's hugely problematic. It represents a fundamental waste of public resources. And I think that all too often what we really should be doing when we're looking at local healthcare services, people who have a proven track record of serving their own local communities when it comes to health-related matters, even promoting various forms of health-related awareness. Those are the people that we need to prioritise when we're filling those positions, and that is simply not the case in modern-day Britain.
Well, OK, Russell, what qualifies anyone to be a diversity chief? Do you have to get a degree in diversity studies? Do you, and this is, I think, a concern, have to subscribe to something like critical race theory?
So what's interesting in this area is about, for me, is about, when you were talking there a moment ago, your guest was talking about the ability to have that experience in different areas. I think that's absolutely brilliant. But actually, first and foremost, the ability to be able to listen and understand and to take in other people's opinions and all, be able to use that. So that person doesn't necessarily have to be an expert in that area. It's the ability to
hang on a minute. If you're earning 75 grand a year, you've got to have a more specific job title than the ability to listen a bit. What are they actually there to do?
Well, what they're there to do is provide a fair, equitable, and safe environment for those staff and those patients that are using that service. So, one of the key issues is that person cannot be a be-all and end-all of and know everything. That person needs to have the ability to be able to interact, to engage, to listen, and to hear the voices of those communities that are most at need and that are going through these disadvantages. And that is the key skill that we're looking for here. You can't expect people to have all those. And in fact, it's not something that we want. We don't want people assuming that they can speak for us, they can speak for communities. That's not what an ally is. That's not what those individuals are. They're here to engage with us, make sure that we'll tell them that they're on track, or what they need to do in those circumstances.
I just want to give Rakib the final word now. Rakib, presumably someone like me couldn't be a diversity chief because I'm white.
Well, I think it's very interesting that you make that point, because when I look at the diversity inclusion professionals, there are certain ethnic groups, including groups in the white mainstream, which are left by the wayside. For example, Gypsy traveller communities, when compared to the white British mainstream, they have relatively negative health outcomes, and that ultimately strikes at the heart of my central point. The idea that British taxpayers would be willing to fund a position for £75,000 for people who aren't experts in that particular field is for the birds. What you need is that when it comes to these positions, you need people with local expertise, people who have a sound understanding of the realities of the ground in different communities in a particular area, so they're able to fulfill their responsibilities in a proper way. And all too often, people in those roles are unable to do so.
Yeah, well, thank you both so much for joining that debate. It's been an interesting one. I'm sure it's one that will divide people for a long time to come, whether the NHS does need diversity chiefs. That was Russell Thomas, Director and Senior Consultant for the Diversity Trust, and Dr. Rakib Ehsan, who specialises in matters of social cohesion, race relations and public security.